I'm Hilary Williams. I'm one of the consultants here at Velindre Cancer Centre. And Anshu and myself, we specialise in bowel cancer.
So Hilary and I work together. I do the radiotherapy side of the treatment. Hilary does the chemotherapy.
One of the most exciting thing that's happening in bowel, and particularly rectal cancer, and rectal cancer is at the very bottom of your bowel and can be quite troublesome to treat, is what we're doing with radiotherapy.
So one of the new things that has happened in the last year or two is that we're combining treatment with chemotherapy and radiotherapy, and we find that in that situation it's given better control of the cancers, improved survival, and sometimes even a complete response with this treatment, so people may not have to actually go for surgery.
And we have our nurses in clinic who often with bowel cancer you can have troublesome what we call symptoms, so our nurses are absolutely key to that. And also our dietitians can be really helpful when people are going through these long course of treatments. They're quite long treatments, aren't they?
They are long treatments, but it does result in better outcomes for patients, and obviously that is quite exciting.
Yeah, we're really seeing that, aren't we? It's like a lot of support from our nurses to get them through those long treatments, but if we can, the outcomes are clearly getting better, aren't they? So I think that's our kind of most exciting area at the moment, isn't it?
That's right. The common symptoms that patients present with this sort of cancer is bleeding from the back passage, diarrhea or sort of change in bowel movements, so they might want to go quite a few times a day, and they can have a bit of bloating and flatulence. Occasionally they can sort of be in pain as well.
Bowel Cancer UK has got really good advice if you're worried about that, but generally we'd say if you're worried about those symptoms, it's much better to see your GP and get checked out sooner rather than later. And also we know that bowel screening is really effective. We think only about 7 in 10 people actually do their bowel screening. Whether it's breast cancer, cervical cancer, bowel cancer, just do your screening. It feels a bit uncomfortable, everyone's a bit worried about these tests, but absolutely they save lives.